Here, few question and answer about oncology. The first question, the nurse is reviewing laboratory result of a client diagnosed with multiple myeloma. Which would the nurse expect to know specifically in this disorder? So our patient diagnosed multiple myeloma, right? So out of 4, which one is the answer? Multiple myeloma, it is the disease of plasma cell that is attack our bones particularly. Multiple myeloma, also known as plasma cell myeloma. Okay, and it is type of cancer of plasma cell, and you know the plasma cell, a type of white cell that is normally produce the antibody. So multiple myeloma, as I told you, they attack the plasma cell and it progress, and patient complain the bone pain, patient develop anemia, kidney dysfunction, and also infection may occur. Sometimes multiple myeloma may complication also common. Complication may include amyloidosis. What is amyloidosis? It is a group of disease where abnormal protein formation or build inside the body. So multiple myeloma patient sign and symptom of the disease, they complain bone pain, typically in the backbone, also weakness, anemia or bleeding, spinal cord compression, pathological fracture, and renal failure or neuropathy. The most important point, what I did not tell you, multiple myeloma patient also develop hypercalcemia, right? Means calcium level go up. So here the 4 options. Let me read from number 4. Decrease number of the plasma cell. Definitely no. It is the cancer of the plasma cell, immature cell, increase the number. So decrease never. Decrease the blood urea nitrogen. Blood urea nitrogen may increase because multiple myeloma affect the kidney and renal failure is common. So it is not answer 2. And patient develop anemia, infection is more common. So WBC maybe go down, right? And also I told you the common presentation or common symptom associated with multiple myeloma is hypercalcemia. So increase the calcium level is our choice. So let me see their explanation for this said. So here, so what is the rationale? Why answer is this? Let me read it. Findings indicate multiple myeloma are and increase the number of plasma cell in bone marrow. Patient also develop anemia, hypercalcemia, and caused by release of calcium from deteriorating the bones tissue. So multiple myeloma attack the bone destructed, bones broken down, they release calcium, and calcium come in blood and increase the level, elevate the blood urea nitrogen level, elevate, not decrease, right? And increased white blood cell count may be or may not be present. Most important, most significant sign symptom, patient develop hypercalcemia. So we choose increase the calcium level. Next question here. The nurse is creating a plan of care for a client with multiple myeloma and, and includes which priority of intervention to the plan. So I make a plan for my patient, but which plan is most important here, right? So first of all, cardiac fluid, provide frequent oral care, coughing and deep breath, monitor the red blood cell count. So here we have 4 options, right? Out of 4, all is important. As a healthcare provider, I must check all of them. But which were the first priorities? Like monitor the red blood cell count. It is important because multiple myeloma patient easily infected by pathogen. So I need to check white blood cell. I need to check red blood cell because multiple myeloma patient anemia develop easily. Anemia is a common sign associated with multiple myeloma. So I need to check red blood cell count. It is important, definitely. Provide the frequent oral care. It is also important to prevent the infection because infection easily attack multiple myeloma. Cough and deep breathing is important too. But what are the most priority? I want to give the most priority. Number 1, enough fluid. Why? Why I want to give this priority? The reason being, multiple myeloma attack our kidney. One point. Second point, multiple myeloma patient, common symptom associated with hypercalcemia. So if calcium level go up, if calcium does not eliminate from the body, calcium precipitate and causes the stone formation. So if you encourage your patient to intake enough fluid, so the calcium easily eliminate from the body, right? So this is the reason the first priority, we encouraging our patient intake enough fluid. Let me read their rationale. Hypercalcemia caused by bone destruction is a priority concern in the client with multiple myeloma. The healthcare provider should administer fluid in adequate amount to maintain urine output. Usually, the amount of fluid should be 1.5 to 2 liters, and some books say 3 liters per day. This requires about 3 liters intake per day. The fluid is needed not only to dilute the calcium overload, but also to prevent protein from precipitating in the renal tubules. Because multiple myeloma also can lead complication. One of the major complications, amyloidosis. What is amyloidosis? It is a group of disease in which abnormal protein called amyloid fibrin build up in the tissue. Next question. A client admitted to the hospital with suspected diagnosis, the Hodgkin disease. Which assessment findings would the nurse expect to note, especially in this client? So, if patient develop Hodgkin disease or Hodgkin lymphoma, so they said, which assessment findings would the nurse expect to note specifically in this client? Means the person who diagnosed Hodgkin disease, right? So Hodgkin lymphoma or Hodgkin disease, it is a type of lymphoma in which a cancer origin from specific type of white blood cell we call lymphocyte, right? So in case of Hodgkin lymphoma or Hodgkin disease, it is basically cancer. And this cancer originated from a specific type of white blood cell we call lymphocyte. Okay. And definitely lymphocyte, if get involved, and if you examine your patient, you can feel the lymph node is enlarged, palpable lymph node. So the person who has Hodgkin lymphoma, we get a special type of cell in histopathology. It is called red Steinberg cell or red Steinberg cell. The basic sign and symptom may include patient complaint fever, patient complaint the night sweat, and weight loss. So here they said 4 option: fatigue, weakness, weight gain, but basic symptom is weight loss or night sweating, fever, and palpable lymph node. So enlarged lymph node. This is the one of the common sign associated with Hodgkin lymphoma. Why it is occur? Let me read the rationale. Hodgkin disease is a chronic progressive neoplasia or neoplastic disorder of lymph node characterized by the painless enlargement of lymph nodes, which is progressed to extra lymphatic sites such as spleen and liver. Weight loss is most likely to be noted. Fatigue and weakness may occur but are not related significantly to the disease. Out of these 4, enlarged lymph node or palpable lymph node is significantly related to Hodgkin lymphoma. Other common sign symptom: weight loss, night sweat, and patient develop the fever. So what next question? So next question here, if during the administration or during the admission assessment of a client with advanced ovarian cancer, the nurse recognized which manifestation as typical of the disease. So question here, my patient diagnosed ovarian cancer, recognized which manifestation as a typical of the disease. First of all, here, diarrhea, hypermenorrhea, abnormal bleeding, and abdominal distension. So, ovarian cancer, keep in mind, it is not uterine cancer, it is not cervical cancer, ovarian cancer. So, ovarian cancer is a cancer that is formed in or on an ovary, means cancer related to the ovary, and it results in the abnormal cell that have in ability to invade or spread to the other part of the body. When this process begins, there may be no or only vague symptom, and symptoms become more noticeable as the cancer progresses. So at the beginning, the sign symptom is very vague. It is really difficult to distinguish with others. So if we say patient have ovarian cancer, what are the most common signs and symptoms, or what are the patient complain, what they said about this, if patient have it? So here this diarrhea is not related to the ovarian cancer, and also it is abdominal distension, what is the most common sign and symptom or related to the ovarian cancer related. Okay. So while the abdominal distension is more common in ovarian cancer, let me read your explanation. So clinical manifestation of ovarian cancer include abdominal distension, urinary frequency and urgency, pleural effusion, malnutrition, pain from pressure caused by growing tumor, and the effect of urinary or bladder obstruction, constipation, ascites with dyspnea, and ultimately general severe pain is more common. Abnormal bleeding often result in hypermenorrhea associated with uterine cancer. It is related to the uterine cancer, not ovarian cancer. So, as I told you, ovarian cancer, it is the cancer what is the related to the ovaries. And other sign symptom we can see in ovarian cancer, sometimes patient complain of weight gain or abdominal pain, tiredness, urinary complaint like frequency, urgency, upset stomach, painful intercourse, and constipation, not diarrhea. Next question here. The nurse is caring for a client. with a lung cancer. And lung cancer is metastasized to the bones. What sign and symptoms would the nurse recognize as indication of possible oncological emergencies? So a patient, you diagnosed lung cancer, and lung cancer is metastasized to the bones, means complication started. So which sign from here we need to call oncology emergencies, right? So we have to know what are the oncology emergency, when we will call. Like a complication of the cancer and causes the infection, and infection develops septicemia or sepsis or disseminated intravascular coagulation. In that cases, we have to call for emergencies. Whatever, select all apply here. First of all, say facial edema in the morning. So if any cancer patient, what is the metastasized facial edema, it is the emergencies. We call to the oncologist. Weight loss, 20 pounds. Weight loss is a common sign of cancer, but it is 20 pounds in 1 month is not that much. Serum calcium level, 12. So serum calcium level is too much, right? Because bones is get involved, bones broken down, and calcium come in circulation, increase the level. So it is one of the significant we need to inform. Serum sodium level 136. So it is very close to normal, right? So it does not indicate any abnormalities. 136. And serum potassium level 3.4, it is also so normal. The numbness or tingling the lower extremity, it means my lower extremity getting involved, right? So what is their rationale? Oncology emergency include sepsis, disseminated intravascular coagulation, symptom of inappropriate antidiuretic hormone, spinal cord compression, hypercalcemia, number 3, hypercalcemia, also superior vena cava syndrome or tumor lysis syndrome. Blocking of the blood flow to the venous system of the head resulting of facial edema is a sign of superior vena cava syndrome. So it is important to notify. Then they said a serum calcium level 12, but normal is 3 millimole per liter, indicate hypercalcemia. Numbness and tingling to the lower extremity could be a sign of spinal cord compression. Mild hypokalemia and weight loss are not oncological emergencies. Sodium level within the normal, so it is not countable. Next to go. So a client who has been receiving radiation therapy, right? So if patient need to radiation therapy, we have to know some few we have to have some few ideas about the radiation therapy. So you can, in case of any emergencies, you can save your patient, right? So for the radiation therapy for bladder cancer, and tell the nurse that it feels as if she is wading through the vagina. The nurse interprets that the client may be experiencing which complication or which condition. So a patient diagnosed the bladder cancer, patient is under the treatment of radiation therapy, right? Radiation therapy or radiotherapy, whatever you like, you can ask. So it is a therapy we use to ionizing radiation, generally provided as part of the cancer treatment or control of a kill to kill the malignant cell, normally delivered by the linear accelerator. So radiation therapy, we use ionizing radiation for the treatment of cancer or control the malignant cell, right? And my patient has a bladder cancer, right? So bladder cancer means cancer related to the or cancer cell arising from the tissue of urinary bladder. But patients who have bladder cancer, the common symptom include blood in the urine or pain with urination. Whatever it is, question is here, patient is want to go for voiding or pee through the vagina. What problem? Definitely there's some problem because radioiodine substance is passing by, right? So rupture of the bladder, development of vesicovaginal fistula. So abnormal opening because the tissue damage, right? So fistula chance to develop abnormal opening in between bladder and vagina. This is the chance. So extreme stress caused by diagnosis of cancer. Alter perineal sensation as a side effect of radiation therapy. In that case, patient chance to develop vesicovaginal fistula or abnormal tract formation in between vagina and urinary bladder. So a vesicovaginal fistula is a genital fistula. Fistula means abnormal tract, and that occur in between bladder and vagina. The fistula is an abnormal opening between these two body parts. And if this occurs, the client may experience the drainage of urine through the vagina. Right? So what are the next? Next question here. They said the nurse is conducting history and monitoring laboratory values on a client with multiple myeloma. What assessment findings should nurse expected to note? Select all. So if my patient has multiple myeloma, so there are 5 options. What possible be chance? So multiple myeloma, common symptom associated with it, patient complain the bone pain, typically backbone or thorax. Pathological fracture because bones is get involved. So it is a chance to develop pathological fracture. Urinalysis positive for nitrate. It is true. If you go for urine microscopic examination, we can get the nitrate is there. Hemoglobin level 15.5. No, patient chance to develop anemia. So hemoglobin may be down. So 3 is not an answer. Calcium level 8.6. Patient chance to develop hypercalcemia. So anemia is more common, bleeding is more common, hypercalcemia is more common. So number 4 is not an answer, right? And also serum creatinine level 2.2. So patient not only kidney get involved, spinal cord compression also most common, pathological fracture, as I told you, more common, neuropathy is more common, also renal failure. If renal failure or renal involvement, so serum creatinine level get up, it is also expected to the nurse, right? So there's a chance. So what is the rationale? Multiple myeloma is a B-cell neoplastic condition characterized by abnormal malignant proliferation of plasma cell. And plasma cell is a lymphocyte. They can produce antibody. Also accumulate mature plasma cell in the bone marrow. The client with malignant melanoma may experience pathological fracture or hypercalcemia, anemia, recurrent fracture, and renal failure is more common. Serum calcium level 8.6, 8.6, and hemoglobin level 15.5 are normal values. Therefore, correct answer are pathological fracture, positive urinalysis for nitrate, and serum creatinine level is high, 2.0. What else? Next question here. So in this question, it is the nurse is teaching a client about the risk factor associated with colorectal cancer. The nurse determined that further teaching is necessary related to colorectal cancer if client identify which items as a associated risk factor. So patient diagnosis colorectal cancer, there are 4 options. Which one is not related or which one is not correct with colorectal cancer? This is the answer. Why? Because further teaching is necessary. Means I'm doing something wrong. As a healthcare provider, you are the person who going to teach me, re-educate me, correct me, right? So first of all, colorectal cancer, there are 4 options. Chronic inflammatory bowel disease. So if any patient has a chronic inflammatory bowel disease, they have a chance to develop colorectal cancer. Or the patient who have a colorectal cancer, they gave you the history of chronic inflammatory bowel disease. So chronic inflammatory bowel disease is associated or the risk factor to develop colorectal cancer. So it is correct. It is not answered. Family history of colorectal cancer. This is the risk factor. So it is related to the colorectal. So it is not an answer. History of colorectal polyp. It is also the risk factor of colorectal cancer developed. Age younger than 50. It is not correct. Usually, patients develop the colorectal cancer when they are more than 50 years old. So it is wrong information. You need to correct your patient, right? So next rationale. Colorectal cancer risk factor include age older than 50. A family history of the disease is a risk factor. Colorectal polyp and chronic inflammatory bowel disease are the cause of colorectal cancer. Next question here. The nurse is assessment in a perineal wound in a client who has returning from opening room following the abdominal perineal resection and note serosanguinal drainage from the wound. Which nursing intervention is most appropriate? So you see this question said most appropriate, and patient has a secretion, serosanguinal secretion, because patient has a perineal wound. Out of four, which one is more major or most in priorities, right? And nurse assessment perineal wound in a client who has returning from operation theater following abdominal perineal resection means patient came after the surgery. Very important, right? So they said cramping the surgical drain. So definitely we do not do this because you allow the secretion came out at the beginning. Chronic change the dressing as prescribed. So there are two reasons here. Mentioning as prescribed, this is the favorable point for NCLEX, as prescribed. And then changing the dressing. Yes, it is very important. Change the dressing because dressing get wet because patient just came from operating room. Notify healthcare provider. Yes, you can do, but most priority is changing the dressing. We never claim remove and replace the perineal packing. You can do this, but later on. But first of all, the first is first. We go for changing the dressing as prescribed. So what is their rationale? They said immediate after surgery, profused serosanguinal drain from perineal wound is expected. Therefore, the nurse should change the dressing as prescribed. A surgical drain should not be claimed because the action will cause the accumulation of the drainage within the tissue. The nurse does not need to notify healthcare provider at this time. Drains and packing are removed gradually over the time, 5 to 7 days as prescribed. And nurse should not remove perineal packing. Next question. The nurse reviewing the history of a client with bladder cancer, right? The nurse expected to note documenting of which is the most common sign or symptom related to the bladder cancer. So bladder cancer sign and symptom basically, right? So cancer related, what is the origin from the urinary bladder? So what are the common sign symptoms of the patient who have urinary bladder cancer? So first of all, is urea and hematuria. So hematuria is the most common sign of the bladder cancer. Or urgency of urination, frequency of urination, right? Urinary incontinence also very important. Or patients sometimes complain abdominal pain, or low back pain if it is metastasis to the bones. As I told you, bladder cancer, basically cancer arising from tissue of the urinary bladder. And the most common symptom include the patient explain my urine mixed with blood, or urine with blood, or blood in urine, means hematuria. Or sometimes they complain pain during the urination, right? Or low back pain. So hematuria is the most common sign. Let me read the rationale. The most common sign of the client with cancer of the bladder is a hematuria. Hematuria means blood in urine, right? The client also may experience irritable voiding, symptoms such as frequency, urgency, and dysuria. And these symptoms often are associated with carcinoma in situ. Dysuria, urgency, frequency of urine are also symptoms of a bladder cancer, but not most common sign.